We are here to discuss with you the methods of prevention for infectious diseases. This includes increasing the amount of immunizations and reducing the rate of preventable infectious diseases through research and evaluation activities. The first infectious disease that we are going to talk about is HIV and AIDS. HIV is human immunodeficiency virus. It is the virus that can lead to acquired immune deficiency, also known as AIDS. People living with HIV may appear and feel healthy for several years. However, even if they feel healthy, HIV is still affecting their bodies. The Center for Disease Control estimates that 1.1 million Americans are living with HIV, and out of that 1.1 million, 1 out of every 5 of them don't even know that they are infected. The number of people living with AIDS is increasing due to the fact that effective drug therapies have been developed which keep HIV-infected people living healthy for a longer amount of time. The CDC has implemented a program to improve treatment, care, and support for persons living with HIV and AIDS and to build capacity and infrastructure to address the HIV/AIDS epidemic in the United States and around the world. HIV is a little different from other infectious diseases in the fact that there is no vaccine to block the transmission of the disease. The only way to block it is to take preventative measures such as using a condom, using clean needles, abstaining from having multiple sex partners, and as well as empowering communities and creating an enabling environment. This prevention method is referred to as combination prevention, and it offers the best promise of success. Within CDC, there is a center called Division of AIDS and HIV Prevention, also known as DHAP. This center has been charged with the mission of preventing HIV infection and reducing the incidence of HIV-related illness and death. There are 2 divisions within the center. One is intervention research and support, and the other is surveillance and epidemiology. The intervention research support provides national leadership and support for HIV prevention research and development, implementation and evaluation of evidence-based HIV prevention programs, serving persons affected by or at risk for HIV infection. The surveillance and epidemiology provides national leadership for HIV prevention research and surveillance and development and testing of effective biomedical interventions to reduce HIV transmission and HIV disease progression in the United States and internationally. Since the first case of HIV in 1981, the CDC has been on the front lines of battle against HIV and AIDS. The number of annual new HIV infections has fallen by more than 2/3 since the height of the epidemic, and HIV-related deaths have dropped significantly since the antiretroviral therapy started in 1996. The most recent breakthrough showed that an early antiretroviral therapy could reduce transmission by 97%. There are still many gaps in the HIV/AIDS prevention, but there are several organizations out there that are trying new methods of prevention and informant education every day. The CDC has set goals to accomplish by year 2015. The biggest mission in this goal is to create easy access and care for those living with HIV and AIDS, and to increase the prevention and care services that are made available for all Americans. CDC's new approach suggests that HIV testing be a part of all routine medical care as a screening test.
Hepatitis is the inflammation of the liver. The most common types of hepatitis are A, B, and C. Viral hepatitis is the main cause of cancer and the most common cause for liver transplant. According to the Centers for Disease Control, 4.4 million Americans are living with chronic hepatitis, and most do not know they are infected. 80,000 new infections occur each year. The populations at risk for hepatitis are Asian and Pacific Islanders, people with HIV and AIDS, homosexual men, injection drug users, and people with STDs. There are 5 types of hepatitis: A, B, C, D, and E. Hepatitis A ranges from a mild infection to a severe illness that can last several months. Hepatitis A is contracted from ingesting fecal matter, even in small amounts. Hepatitis A vaccines are recommended for all children starting at age 1. Hepatitis B can be acute or chronic. Hepatitis B is spread through bodily fluids from sexual contact or sharing needles and syringes. Hepatitis B can be passed from mother to child at birth. The Center for Disease Control recommends testing and vaccinations for all countries where hepatitis B is common. Hepatitis C is spread from blood of an infected person entering the body of someone who is not infected. Hepatitis C is most commonly spread by sharing of needles used for drug use. Hepatitis C often becomes a chronic disease that can lead to cirrhosis and liver cancer. Hepatitis D is very uncommon in the U.S. and only occurs among people who are already infected with hepatitis B. Transmission requires contact with infected blood. Hepatitis E is rare in the U.S., but common in other parts of the world. Hepatitis E is similar to hepatitis A because it is transmitted from ingestion of fecal matter. Hepatitis E is usually associated with contaminated water supply in rural parts of the world. Currently, there are only vaccines available for hepatitis A and B. If you have been around someone with hepatitis or believe you could be infected with hepatitis, you should contact your physician to get tested. For more information on hepatitis, visit the CDC website.
Tuberculosis is a disease caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attacks the lungs, but can attack any part of the body, such as the kidney, spine, and brain. If not treated properly, tuberculosis can be fatal. Symptoms include a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood, weakness or fatigue, weight loss, no appetite, fever, or sweating at night. There are 2 kinds of tests that are used to determine if a person has been infected with TB bacteria. The tuberculin skin test, which this test is performed by injecting a small amount of fluid into the skin in the lower part of the arm. Within 48 to 72 hours, it will be checked for reaction. The reaction could be a raised hard area or swelling. A positive skin reaction means the person's body was infected with TB bacteria. A negative skin reaction means the person's body did not react to the test and that TB infection is not likely. A TB blood test measures how the immune system reacts to the bacteria that causes TB. The TB blood test, also called interferon gamma release assays or IGRAs. 2 FDA-approved IGRAs are available in the U.S. include QuantiFERON, a TB Gold in-tube test, and a T-spot TB test. A positive IGRA means the person has been infected with TB, and a negative IGRA means the person's blood did not react to the test and TB is not likely. TB bacteria becomes active, meaning it multiplies, if the immune system can't stop them from growing. TB can be treated by taking several drugs for 6 to 9 months. There are currently 10 FDA-approved drugs in the United States. It's very important that people who have TB finish the medicine taking the drugs exactly as prescribed. How exactly is TB spread? TB germs are put into the air when a person with TB disease of the lungs or throat coughs, sneezes, speaks, or sings. These germs can stay in the air for several hours, depending on the environment. People who breathe in the air containing these TB germs can become infected. This is called TB infection. Vaccines include BCG, Bacillus-Calumet-Guerin, is a vaccine for TB disease. This vaccine is not widely used in the United States. It's often given to infants and small children in other countries where TB is common. However, it is not always 100% effective. Who should get tested? People who have spent time with someone who has had TB disease, people with HIV infection or other medical problems that weaken the immune system, people who have symptoms of TB disease, which include fever, night sweats, cough, and weight loss, people from a country where TB is common, and also people who use illegal drugs. If you have been around someone who has had TB disease, you should go to your doctor or your local health department for tests.